I'm sorry, buddy. I didn't think it was going to work. Oh, hey there. Carl and I were just talking about some of the commonly asked questions in the office that almost on a daily basis that patients ask us. And one of those is, Doc, what kind of shoes should I wear? Or Doc, what kind of mattress should I own? Or Doc, what kind of pillow should I use? And when we were talking about that, Carl, he decided that he wanted to try on a pair of shoes and explain that might not work very good. But let's talk about shoes for a second. This is going to be our health tip of the week here. I'm going to talk about these subjects because they really are commonly asked questions, and most of the time people are not real sure what to do with these subjects. Shoes is something that's fairly difficult, really, because everybody's feet's a little bit different. Most of the time there is a lot of shoe stores anymore that will fit you for shoes, but it's really probably the females or the women that I want to address the most. Most of their shoes are designer shoes, and to be quite honest, they're terrible on our feet. They're very narrow up in the toe area. Women will get a lot of toe problems, even arch problems from them. High heels, I know a lot of you ladies out there love them, but really you need to throw them away. High heels cause your heel to elevate, obviously, which causes your pelvis to rotate forward. When that happens, it causes an excessive curvature in the lumbar spine. Now, I know we love to wear them because they make our legs look good, make you taller, but in reality, they're just not very good for your spine and nervous system. So try to wear a flat shoe. Shoes don't last forever, and so periodically, every few months, maybe 6 months, if you wear your shoes a lot, you probably should replace them. Try to find a shoe specialist in your area. A lot of chiropractors are trained in evaluating shoes, so if you have a chiropractor, they can probably help you out. If not, find a running store or just a real reputable store company that has somebody that has some knowledge in it. Women, find designer shoes that are wider. They're certainly better for your feet. The next question is mattresses. Now, this is kind of a tough subject because mattresses, you want to buy what you can afford. What I mean by that is most of the time the higher end mattresses are better mattresses. You want a mattress that has good support, but yet it's kind of that happy medium. You don't want it to be too soft because it won't support the spine very well. But if it's too hard, it can be really challenging on our joints, our shoulders, our hips, and our lower back. So you need to go, you're going to have to lay on them, try them out. There's some really good reputable companies out there. I'm a pretty big fan of Tempur-Pedics, which are the memory foam. Stearns & Foster make an excellent coil spring mattress. A coil spring mattress is what we traditionally think of. There's some good air mattresses. Buy them from a place that you can return them. A lot of mattress companies have return policy. They might have 60, 90, or 120 days that you can try it out. When you're spending that kind of money, you want to be able to try it out. If it doesn't fit you, after a couple of weeks, if you're not sleeping well on it, it's not comfortable, you need to take it back and try something different, because there's not a one size fits all for everybody. Everybody's a little bit different on your needs when it comes to a mattress. But buy a good one. They'll last you longer. You'll get more support out of them. You'll probably be happier with them. If you can't afford some of those expensive mattresses, there's other companies that sell good mattresses that you'll get along with just fine. They might not last as long, but they're still a good mattress. The last question is pillows. This is another subject that we kind of got to go over. First off, you need to identify if you are a back sleeper or a side sleeper. And let's pay attention here. Never, ever, 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 ever sleep on your stomach. When you sleep on your stomach, your neck or your cervical spine has to turn one way or the other, which will cause neck problems. Secondly, when you're laying on your stomach, your spine is not supported. It's just kind of hanging there in the cavity. It can create some health problems. If you're a back sleeper, you want typically a thinner pillow. Carl, can we use you for a minute, man? Okay. Let's say Carl's sleeping on his back here, like this. We should maintain that normal curve of the neck. It should be like a banana-shaped curve. So we want a thinner pillow for Carl to lay on, which will maintain that curve. If it's too thick of a pillow, it's going to start to push his head forward. When you push his head forward, that starts to take away that curve, and again, it'll cause some spinal problems down the road. So you want a thinner pillow when you lay on your back. Now, when you lay on your side, this is a whole different animal here, because you want a pillow that's a little bit thicker. You have to take up the distance from your shoulder to your ear when you're on your side. If it's too thin, as you'll see, Carl's neck is going to fall down, put a bend in it that way. But just the opposite, if it's too thick, it's going to go up. And so we have to have a pillow that's going to maintain that proper height there. Now the trick is, if you're a combination sleeper, if you're a back and a side sleeper, then a lot of times you need a specialized pillow. And this is what we call a cervical pillow, as you see here. This pillow does both. It's got two different sizes here, but you can lay on your back with your head laying down here and your body running that direction. And then when you roll over on your side, you can use the thicker side portion. Now, caution here, you don't want to lay on your side in here because that's going to put an abnormal curve in the neck. So there's just some options. I tell some people use two pillows. You know, if you have a large enough bed, have a thicker pillow to lay on your side, have a thinner pillow right next to it. So you roll over on your side on one side, you can roll over on your back the other way. That typically works pretty well. If you have any questions, feel free to email our office. Remember, get yourself and your family in, get them checked out, make sure your spine and nervous system is functioning well. Until our next week's health tip, be well.